Hello and welcome. Today, we're diving into a medication with a seriously long name, but an incredibly important job: antithymocyte immunoglobulin. So, what is this stuff, and what does it actually do?
Let's start with a really fundamental problem in medicine. Say someone gets a life-saving organ transplant. It's an absolute miracle, right? But the biggest hurdle often isn't the surgery itself. It's answering this one question. How do you stop your own body from seeing that new organ as a dangerous invader and trying to destroy it?
And that gets us right to the heart of it, what we call the rejection problem. This isn't your body getting something wrong. In a way, it's your body doing its job perfectly, just at the worst possible time.
Yeah, think about it. Your immune system is this amazing, highly trained defense force. It's constantly on the lookout for anything that isn't you. Viruses, bacteria, you name it. The problem is, to that defense force, a brand new, desperately needed kidney or heart, well, it looks like the biggest, most dangerous invader it's ever seen.
So how on earth do you solve that? You can't just switch the immune system off entirely. That would be disastrous. Instead, doctors bring in something you could think of as a temporary peacekeeper.
And here it is, antithymocyte immunoglobulin. I know, it's a real mouthful, but the name actually tells us a lot. Thymocytes are related to T cells, and T cells are basically the frontline soldiers of your immune system. So this drug is what's called an immunosuppressant, and its whole purpose is to specifically dial down the activity of those T cells so they don't attack the new organ.
I love this analogy because it's spot on. This drug isn't a sledgehammer that just knocks out your whole immune system. It's much more like a highly specialized security team. It comes in, talks to the most aggressive parts of your immune system, those T cells, and just calms everything down for a little while. It creates this crucial window of peace so the new organ can get settled in and your body can start to accept it.
Okay, so when do doctors actually call in this specialized team? Let's take a look at the treatment blueprint to see how it's used in the real world.
So it really has two main jobs. First, you see it's used for prophylaxis. That's just a fancy word for prevention. It's given to heart and kidney transplant patients to stop rejection before it can even get started. But its second job is just as critical. It's also used to treat rejection if it's already happening in kidney transplant patients. And you'll notice the treatment course for that is often longer, maybe up to 2 weeks.
Now this is a really crucial detail for doctors. Getting the dose right is everything with a powerful drug like this. For patients who are obese, the dose isn't based on their actual weight. Instead, it's calculated using their ideal body weight. It's a really important safety check to make sure they're not getting too much of the medication.
Of course, intentionally tamping down your body's main defense system is a serious business. It's not something you do lightly. So, how do they do it safely? And what are the potential downsides? Let's get into navigating the risks.
Right, so this is definitely not a pill you just swallow. It's a very precise and careful process. First, the powder in the vial is mixed with sterile water. Then it's gently rotated, and that's important, not shaken, to dissolve everything. After that, the dose is diluted into an IV bag, and it's always given through a special microfilter. Finally, the infusion itself is done super slowly, over at least 6 hours. The whole thing is designed to be as safe and gentle on the body as possible.
So is there ever a time when this drug is an absolute no-go? Yes, and it's a big one. An active infection. That makes total sense, right? The last thing you'd ever want to do is suppress someone's immune system when it's already in the middle of a big fight with something else.
And that brings us to side effects. The more common ones are things you might expect from a strong infusion: chills, fever, nausea. And of course, because you're suppressing the immune system, you can see things like low blood cell counts and a higher risk of infection. Then there are the less common but more serious possibilities, like severe allergic-type reactions.
But here's the thing. Clinicians don't just sit back and wait for these to happen. They have a whole strategy to get ahead of it. To make the infusion easier to tolerate, they'll often pre-treat with other drugs, like an IV corticosteroid, an antihistamine, or even something simple like paracetamol to help manage any fever. It's all about being proactive. And finally, a few other essential precautions. When it comes to pregnancy and breastfeeding, it's a serious balancing act. It's only used if the benefit is absolutely thought to outweigh the risk. And critically, a patient's blood counts have to be checked regularly all the way through treatment to spot any potential problems early.
Okay, so we've seen how it works, when it's used, and the risks involved. But what's the official word on this drug? Where does it fit into the bigger picture, say within the UK's National Health Service?
Now this is really interesting. This is guidance from NICE, the body in the UK that assesses medicines. And back in 2017, they recommended that this drug should not be used as an initial treatment to prevent rejection in adult kidney transplants. The key word there is initial. This doesn't mean the drug is bad. It often means that for that specific first-line prevention job, newer or more targeted drugs have come along. It leaves this one as a powerful tool to be used for treating active rejection or in other more complex situations where you really need its strength.
And here's a dose of real-world economics. The hospital cost for just one 25-milligram vial is over 150 pounds. And remember, the doses are based on body weight and given for several days in a row. You can see how the cost of a full treatment course adds up really, really fast and becomes a major factor in these decisions.
And that really brings us to the big, final question. How do we, as clinicians, patients, and healthcare systems, balance everything? You've got the incredible benefits of a drug like this on one side, and on the other, you have its very real risks, its high cost, and the official guidelines that shape its use. It's the central puzzle of modern medicine, all wrapped up in this one remarkable drug.